Social Security, Medicare, and public education are all part of what we consider the welfare state. The welfare state is all transfers to government transfers provided to the population and services. And so that includes Medicare, Medicaid, and public education. And those, as you know, have a really broad support in the American population. In terms of transfers, it does include social assistance, that is cash payments to non-working poor. But the big piece of it is pensions, that is our Social Security system. Social Security is many times what social assistance is. And it also includes unemployment compensation, which is also a popular program, though of course not as popular as Social Security. Okay, now let's talk about European welfare states and how they differ from the United States. I'm going to sort of do this broad strokes because, of course, there's a lot of variation within Europe. I'm going to focus mainly on Northern Europe, that is Germany, Belgium, France, the Netherlands, and the Nordic countries. So that's most of the population of Western Europe. In these countries, the welfare state is very comprehensive, meaning that almost every area of transfers is covered, and generous, generally in programs like pensions or unemployment insurance. Your replacement rate that's what you get when you become unemployed or when you go into pension, will be 70 to 75% of your working pay. So it's more generous than what we have in the United States. And indeed, we have big holes. So we have disability insurance and they have disability insurance. But paid sick leave, we don't have in the United States. We have a couple of unpaid weeks. In Europe, they typically will have something like 26 paid working weeks in many cases of sick pay. Now, of course, you have to really be sick. You can't just stay home on your own. But then they have areas that we don't have. Child allowances. Almost every European country has a system whereby families get flat rate payments each month for each child that they have. Maternity leave pay. Typically, these Northern European countries will have 9 months to about 14 months of maternity leave pay at 3/4 of the working pay. The replacement rate is 75%. And then with regard to services, of course, like the United States, they have public education systems. A big difference is those countries I named, all of them, tertiary education, that is university, is free. All European countries have universal health care coverage. The only variation between them is whether they have social insurance systems where you have government insurance and private doctors, that's continental Europe, or the Nordic countries where the government actually provides the health care. Another thing that is much more comprehensive about European welfare states as compared to the United States is the daycare system. Again, the Nordic countries are in the lead, and typically in those countries, for everybody, all children above 2, there are daycare places for them, and they're subsidized so that nobody has to pay too much. You do have to pay cash out of your pocket. And now, increasingly, the continental countries, which used to have a much more conservative model, encouraging women to stay home, now are moving to the Nordic model.